States across the country have just 8 months left until they need to implement the Medicaid work requirements mandated by President Trump's so-called Big Beautiful Bill. But one Republican state decided to eagerly beat that deadline. On Friday, Nebraska became the first state to enact Medicaid work requirements. The move is expected to strip coverage from around 25,000 residents who qualified for the program under the Affordable Care Act's Medicaid expansion. An estimated 72,000 Nebraskans will be subject to the policy, which applies to able-bodied adults ages 19 to 64. Joining us now is Sherry Gleed, professor of public service at NYU and former Obama administration health official. Sherry, thanks so much for joining us. Could you talk to us a little bit about what the practical effects may be of these work requirements in Nebraska?
So the way the work requirements are going to work, or are supposed to work, is that people who are eligible for Medicaid on the basis of their incomes will have to prove that they've worked enough over the past month, 2 months, 3 months, depending on how a state sets it up, in order to retain their Medicaid coverage. They'll have to give proof that they've either worked 80 hours in the past month, or that they've met an earnings threshold, or that they meet one of a host of different exemptions. The consequence of this actually is going to be that there's a lot of paperwork that people are going to have to do over and over and over again in order to stay on Medicaid.
Yeah, and I think we actually have a chart showing, this is from KFF, showing that most people who are on, the vast majority of people who are on Medicaid, I don't know if you can read this, are either already working or have one of these exemptions. So, 44% are working full time, another 20% are working part time, and then most of the remainder are people who have one of these qualifying exemptions. They're in school, they have illness or disability, they're caregiving, et cetera. It's a very tiny fraction of Medicaid recipients who are not working and would be, in theory, are supposed to be the undeserving, right? The undeserving poor as opposed to the deserving poor. So I guess the question is, these work requirements are generally popular with the American people, but is it kind of a solution in search of a problem? Like, does this actually fix anything?
It's a really cynical policy. And the reason it's a really cynical policy is because those few people who are not working and don't meet any of those exemptions, Mike Johnson talks about gamers in the basement, kids who were not doing their thing. Well, we're talking about Medicaid here. So do you think those people are going to the doctor for their preventive visits between games in the basement? The people that they're kicking off Medicaid in principle, not in practice, but in principle, are people who don't use a lot of health care services. In our analysis, 40% of them never went to the doctor at all in the previous year. This is a really low-cost group. But they're expecting a lot of savings from this program. Where are those savings going to come from? Basically from kicking off people who really do use services, and those are people who are supposed to be exempt. They're not the undeserving poor. They're sort of the people we all think deserve to be on Medicaid, but they won't be able to keep up with all those paperwork requirements.
So speaking of Mike Johnson, let me actually play for you what he said back in the spring when Republicans were trying to actually get Trump's big, beautiful bill passed, and he actually dismissed the concerns of Medicaid cuts. Take a listen.
The numbers of Americans who are affected are those that are entwined in our work to eliminate fraud, waste, and abuse. And what do I mean by that? You got more than 1.4 million illegal aliens on Medicaid. Medicaid is not intended for non-U.S. citizens. It's intended for the most vulnerable populations of Americans.
So some experts at the Urban Institute have since warned that this cut, these people, the number of people that would be put off of Medicaid cuts would be up to 10 million people.
Right.
What do you estimate, and do you agree with that?
So I think the estimates for the total effect of all the Medicaid cuts in the Big Beautiful Bill come around 10 million people, probably about half of that just from the work requirements. There are other provisions in the bill that also will cut the number of people on Medicaid.
So the work requirement is politically popular, but it's not as well known what the administrative cost of this is, and factoring in putting people on the rolls, kicking them off? And then what happens, I want to know, when, say, someone in Nebraska gets kicked off of Medicaid, then they have a stroke over the summer, and then, back and they're not able to work, and then they need to get back on in the fall. Like, how does that work? And is there any net savings when the preventative care element is taken out of the equation?
So what we know is Georgia tried to do this in the past. They wound up spending, depending on the estimate, between 2 and 3 times as much money on administration as they did on actually providing people with health care. So you can build up this enormous bureaucracy that just consists of checking boxes, and you're not actually giving people the medical care that they need. What will happen in this case, I don't know exactly, because we don't actually have all the rules. CMS hasn't actually given the guidance yet. But what is likely to happen is that people are likely to spiral on and off Medicaid and get on it when they're sick and then fall off it when they're not as sick or when they just haven't filled out the paperwork. And they're going to be at the hospital. The hospital's not going to get paid for their care. So we're going to see hospitals in decline and lack of care for other people as well.
The other piece of all of this that I think is really interesting is that ostensibly this is supposed to be about work, right? About promoting work. And if you look at what happened in Arkansas, where they implemented Medicaid work requirements in the first Trump administration, there was a study in Health Affairs that found that there was no effect at all. No, work requirements did not increase employment over 18 months of follow-up, but did kick whatever it was, 18,000 people off of Medicaid. You are a trained economist.
Right.
Is there any mechanism by which, like, dangling the prospect of taking away someone's health care or giving them health care will actually encourage them to work?
It's really hard to imagine that there are a lot of people who are only on Medicaid, who are not working because they are on Medicaid. It's just such an odd thing to think about. It's Medicaid. You don't even need it unless you're sick,
really
right?
Sick,
like, it's not like... It's not a great idea, in my opinion, to have work requirements for anything. But in the case of health insurance, it's a particularly odd rationale to imagine that people are staying away from work so that they can have their health insurance.
And some people need their medications in order to work.
Absolutely. So we also have big populations with behavioral health problems, with substance use problems. Imagine people with depression. So in principle, you're supposed to be exempt from this requirement if your depression is bad enough. But if your depression is bad enough, are you actually going to be able to keep all that paperwork in effect month after month in order to stay on Medicaid? You'll probably fall off at some point. Is that going to increase your likelihood of being at work?
Sherry Glied, thank you so much for being with us tonight and breaking all this down.